Hi there. In this video we're going to be talking about CPR and the adaptations that have been put into place during the COVID-19 pandemic. Don't forget to hit subscribe and that notification bell so you can keep up to date with all our latest videos. Now, sudden cardiac arrests happen every day and many of them unfortunately happen outside hospital. Here in the UK, just 1 in 10 people survive. One day you might actually witness someone collapse and stop breathing in or outside of your house, and you might be the only person there that can help them. Now, unfortunately, reports show that during the COVID-19 pandemic, the chance of survival in many countries, including here in the UK, might have decreased even further because fewer bystanders are willing to intervene when they see someone that has collapsed and stopped breathing. So I'm urging everyone here in the UK and all over the world to learn CPR right now. Because right now, even during the pandemic, there are people across the world that need you to help them, and you need to be able to perform CPR if that person has a cardiac arrest. Now, of course, we need you to be safe as well. So performing CPR during the COVID-19 pandemic, there was a few adaptations that have been put into place by the Resource Council in the UK. The first step they've changed is we no longer open the airway. We no longer put our cheek or face next to that person's cheek or face. We're just looking for breathing. We're looking for the rise and fall of the chest. We're not giving mouth to mouth, as in rescue breaths, and we're just doing compressions. We're also covering their mouth with a cloth to avoid any water vapour coming out towards us. So even during this pandemic, there is still a way you can help save someone's life, because somebody is relying on you to perform CPR to them. But please make sure you stay safe and follow this short video which will explain how to reduce the risk of COVID-19 transmission. So we come in and we check the air for danger. We then check for response by talking to them. Hello, are you okay there? And then gently put pressure on their shoulders to try and see if they can wake them up. I'm trying to keep my head away from their head. And I'm going to look and see if they're breathing. I'm just going to check and see if I can see the rise and fall of their chest and their belly. They're not breathing. So now I need to go and call the ambulance straight away. And then I'm going to cover their mouth and nose with a cloth or maybe their t-shirt and just begin compressions. And I'm going to do continuous compressions, pushing down 5 to 6 centimetres in depth. I'm going at the speed of 100 to 120 beats per minute, making sure I take my hands off every time. So remember, don't put your head next to theirs. There is no need to do mouth to mouth. Cover their mouth and nose with a cloth or a t-shirt and perform compressions and compressions only. Please also remember about the importance of using an AED, and when you call the ambulance, if there is anybody else available around the house, send them off to go and look for an AED for you. Don't forget to follow our YouTube channel and we'll explain how to be able to use an AED. In fact, we'll leave it in the description below, a link to how to use an AED and also where to find them. Thanks for listening, guys. Keep safe, keep well, take care.